Hello, everybody. I'm Dr. Salvador Medina. We are here at Aroa Center in our office here in Tijuana. I wanted to take a little bit of time to talk to you about basically what type of surgeries, plastic surgeries we do here at Aroa Center. Within the aesthetic surgery, we do almost every type of procedures. Something that I specialize in, and it's type of procedures that I do the most, are massive weight loss procedures. These are in patients that were overweighted or obese. They had a massive weight loss that could be with a surgical procedure or just without change in lifestyle, that they lose a lot of weight. So this brings a lot of consequences on your body, the shape of your body, your skin quality. So we have a lot of laxity and loose skin after losing a lot of weight. This brings a lot of issues that some are personal aesthetic problems and others are functional problems. Having a lot of extra weight on the abdomen area, the breast, the arms can be very difficult to handle. So that's when patients, after losing a lot of weight, they seek these I consider them reconstructive procedures. They have their aesthetic component, but they have their reconstructive component. So they seek help to manage all this excess skin. And it has to be done with surgical procedures. We need to remove a lot of extra skin. And this affects the whole body. It could affect the face, the breast, the arms, the back, the upper back, the lower back, the butt, the thighs, the inner thighs, the outer thighs. Almost all the body is affected by this weight loss. So the procedures that we do here are correction of all these areas. Since all the body cannot be operated or managed in one procedure, we need to stage these procedures. We need to divide 3, sometimes 4 procedures. So this is a big topic because patients would like to have everything done in one procedure. That would be great, but we can't. And we can't because it would be too much time and we have to think about patient safety. So that's the most important part of that. We stage these procedures because we're thinking about patient safety. So we can start with the facial part or the body. We usually divide. We usually don't combine facial surgery with body contouring. Within the body contouring, we can work with basically 2 areas, the upper body and the lower body. The upper body, we do procedures to correct the breast. That can be a breast lift, a breast augmentation, or a breast reduction, depending on each patient's needs. For the arms, brachioplasty, take out that excess skin. We can do liposuction, improve the contour, and the lateral part of the thorax and the upper back. So we do thoracoplasty, usually the lateral area, which takes care of the upper back. Then we do the lower body lift, which is usually the circular abdominoplasty. We usually don't do the standard procedure that we usually know as a tummy tuck, because we need to correct not just the interior part, but the lateral part of the hips, the lateral part of the thighs, the lower back, and the butt area. So for that, we need to go all the way around with the lower body lift or the circular abdominoplasty, or also known they call it the 360 abdominoplasty. We can add liposuction to improve the contour. We can do fat transfer to the butt, the BBL, to also improve and enhance the shape and a little bit the size. That will also improve the thighs, the lateral part of the thighs, a little bit the interior part, not so much the inner part of the thighs. Then the other area that we can take care of is the inner thighs. We do an inner thigh lift. That can be done with a short scar that's in the groin area, or the extended scar that goes down to the knee. And that also depends on each patient. Within these areas, we can do certain combinations. That could be sometimes the circular abdominoplasty, the liposuction, the fat transfer, and the breast surgery. We can do that combination. We do that very frequently. And within the safety of amount of hours that takes us to do this procedure, we're usually 2 plastic surgeons that work in the same procedure, that they help me. So that's a combination that we can do very well. We do that very often. We improve very well the interior part of the abdomen. We work with the abdominal muscles. We improve the lateral part of the thighs, the butt area, lower back, and the upper back with the liposuction, and then do the breast surgery. We usually have very nice results. It is a very big surgery. The recovery time, usually for you to go back to your regular activity, including exercising, is 2 months. We have to use a compression garment. We do use drains for the abdomen, 2 drains. They usually stay in, could take up to 3 weeks, depending on the amount of fluid that comes out. So usually patients, if they come from out of town, they go back home with the drains. So that's probably the most common combination that we do, because when they start with these body contouring, that's probably their main concern: abdomen, the butt, and the breast. Then we can do the arms and the inner thighs. Then facial surgery, that it's also a whole other topic. We always have to see in the facial structure what needs to be adjusted, what we need to add, sometimes a lot of volume, because with the weight loss we lose a lot of volume in the face. So I do fat transfers to the face to regain these volume losses that we have. We work with the eyebrows, eyelids, the upper eyelids, lower eyelids, cheek, mid-face, neck. So we need to analyze what each patient needs, and we go from there. So there are a lot of procedures that we can do in patients that have lost a lot of weight. Of course, we don't need to do every single part of the body. That depends on each patient, what they want. But we do need to stage these procedures. That's very important. The other topic is about coming down to Tijuana. A lot of patients trust us with their bodies, their health, coming down for surgery here. But it is important to know that if you decide to go to, not necessarily Tijuana, but if you go elsewhere for a procedure, you have to be very careful of where you're going to do it and who you're going to do it with. Here in Mexico and here in Tijuana, it's very important for you to know the difference between a plastic surgeon and an aesthetic surgeon. People wouldn't know that they're different, and they would think that everybody does aesthetic surgery, but there are very, very big and very important differences between a plastic surgeon and the aesthetic surgeon. For us here in Mexico, to be a plastic surgeon, you have to study medicine, which is 6 years. Then you have to go through 6-year period of training for plastic surgery. You do some general surgery, usually 2 years, and then you have to do 4 years of residency in plastic surgery. So after 6 years, you can become a plastic surgeon. And after that, we sometimes do subspecialties. The difference with the aesthetic surgeon is that the aesthetic surgeon, after studying medicine, they can do 1 year training in just aesthetic procedures. And this training is part done online, and they do a certain amount of surgeries, and they graduate. They only do aesthetic surgeries, and just in 1 year. Plastic surgeons, we do mostly reconstructive surgeries, and then we train in aesthetic surgery. So the training is completely different. The way we treat the skin, techniques that we use, they're completely different. And also very important is how plastic surgery, every single plastic surgeon can have complications. We always have. Fortunately, the percentage is very low, but when we have a complication, we know how to treat it. The aesthetic surgeons, they have very, very little experience in doing that. That's probably the other important difference between a plastic surgeon and the aesthetic surgeon. So it's very important for you to know where you're going and who you're having surgery with. How can you know who is a plastic surgeon and who is an aesthetic surgeon here in Mexico? We have certifications. Probably the most important one is the one called Consejo Mexicano de Cirugía Plástica. That would be the Mexican Council of Plastic Surgery. You can always go online and search for these certifications. We usually have, they're giving us like a QR that you can scan, and there you have the information of who is certified by the Mexican Council of Plastic Surgery and who is not. So if your doctor is not certified by the council, could be that it's because he's an aesthetic surgeon, and you should be aware of that. That's very important. So those are probably the topics that I wanted to talk to you about this time. And if you have any questions, just let me know.